are you doing today?
Hi, I'm good. How are you?
I'm good. My name's Haley. I'm an occupational therapy student. I'm going to be checking on your hand today. Can you verify your name for me?
Sherry Lee,
Okay, Sherry. Can you tell me your date of birth?
8/29 of 1966.
Oh, 1966. What a good year. Okay, so I see on this documentation that you fractured your wrist 2 months ago and you had surgery 6 weeks ago.
Yeah.
Yeah?
I did.
How's it feeling right now? Could you rate your pain for me on a scale of 1 to 10?
Right now, it's about a 2 or 3.
2 or 3, awesome. Because it says a couple weeks ago you said it was a flat 3. So not many changes on current pain. What about on a bad day?
On a bad day, it maybe gets up to about 5 on a really bad day. Normally it's about a 4 after I do stuff with it.
Okay, good. Yeah, that's awesome because you said a couple weeks ago on a bad day it was about 7 to 8 out of 10, so it is getting better.
Mm-hmm.
Yeah, awesome. I see on here that you still you've been battling swelling, and I see you still have a little bit of swelling. You mind if I check that?
Yeah.
Okay. So, awesome. Okay. So, have you been icing your wrist at home?
Not as much as I should, honestly.
I get that. I see that you also have recorded some numbing in the top of your hand. How has that been?
I think it's getting better, honestly. I don't notice it as much anymore.
Okay, good. Okay, well, I'm going to do a little test to double check that. Is that okay?
Yeah, that's fine.
Okay, so this test is called a 2-point discrimination test, and I'm going to put it on the back of your hand. I'm going to use your non-affected hand to demonstrate.
Okay.
And watch it while I do it on your non-affected hand, because when I do it on here, you'll have to have your eyes closed.
Okay.
So, see the 2 points right there?
Mm-hmm.
Okay, and then see the 1,
Mm-hmm.
and then the 2 points. 2 points, and 1. Okay, so I'm going to do that on this hand, and for the back of your hand, it has to be 20 millimeters, so I've got it this far. Some of them, like the front of your hand, people have it like this close.
Oh my goodness.
Yeah, it's crazy, because I can really feel 20 millimeters. Okay, can you close your eyes for me?
I can.
Perfect. 1 or 2?
2.
Okay. 1 or 2?
2.
Okay. 1 or 2?
1.
Awesome. 1 or 2?
2.
Perfect. 1 or 2?
1.
Yeah, okay. You can open your eyes now. Perfect. So you got that sensation. So since you said you really don't like ice, we're going to switch it up a little bit today. We're going to do a contrast bath instead.
Okay.
And this contrast bath, we still have to put our hands in cold water, but then we get to put it in hot water. And we even get to put it in hot water first and for longer than cold water.
Okay.
So I think you're going to like that.
Okay.
Yeah? Okay, so can I have you wash your hands for me real quick?
Absolutely.
Perfect. So this is the contrast bath I was talking about. We have the hot and the cold water, and we'll sit in the hot water for about 20 minutes, or 4 minutes, sorry, not 20.
It's
We'll
okay.
sit in the hot water for about 4 minutes, and then we'll move to the cold water for 1, and then we'll move back to the hot water for 4 minutes, and then keep that rotation for the next 20, okay?
Okay.
Okay, so before I start, you mind if I check your incision?
Yeah.
Make sure everything's okay. I know it said you were good last week, but I just want to double check. Okay, I'm gonna put that back down for now. Do you have any heat or cold tolerance? Does it bother you?
No.
Does it burn your skin, cause any irritation?
No. I mean, sometimes after really cold ice, my skin will be red, but it's after a while.
Okay, okay, good. So I'll check the temperatures of these to make sure before, and I'll have you tell me also. I want you to communicate with me if that's too hot or too cold.
Okay.
And do you have any heart problems that I'm not aware of?
No, not to my knowledge.
Okay, what about like BioFreeze or any topical cream? Did you put anything on this morning to help with pain?
Not today.
Okay, good. So before we start, I'm going to check the temperature of the hot and cold to make sure it hasn't dropped too much or gotten too hot. Okay, awesome. The hot is 98, which is exactly what we want. It should be between 98 and 110. I didn't want it too hot for you the first time just to make sure. And I'm going to check the cold water. All right, it's about 56. It should be between 50 and 60.
Okay.
So we're going to start off with that hot water. Go ahead and put your hand in there. Awesome. Hold it. You can go ahead and get comfortable. We're going to sit here for about 4 minutes, okay?
Okay.
Okay. So the purpose of this is actually going to help with your swelling. Since we're putting that cold on there, it's going to decrease your swelling. It's going to increase your joint mobility. and decrease that pain. So hopefully we'll be a little bit painless after this.
Okay.
And then it's also going to speed up the healing process, so we can get back to driving to the yoga class you teach, cooking, and picking up that big old Stanley cup you like.
Oh, thank goodness.
Okay, I know you won't have to carry around that dusty old water bottle anymore. We'll be back to the 40 ounces of water, and we'll just increase that with treatment. Okay.
Okay.
All right. So it's been about 4 minutes. So I'm going to pick up your arm. We're going to switch. Awesome. Is that too cold? Is it okay?
Feels okay.
Okay, good. Are you comfortable?
Yes.
Okay, perfect. All right. So it's been about 1 minute. We'll go ahead and switch. All right. How'd you like that contrast bath?
I really enjoyed that.
Yeah?
It was nice.
Good. So how's your pain now on a scale of 1 to 10?
Maybe a 1 or a 2.
That's awesome. That felt really good?
It did.
Okay, good. Well,
It did help.
good. Awesome. So since we are 6 weeks post-surgery, I'm going to have you put this wrist cock-up splint back on, except you only have to wear it when sleeping now. You don't have to wear it all the time anymore.
Oh, thank goodness.
Oh, I know. So this is still going to help decrease your pain and mobilize that joint while you're sleeping and resting, because you're probably going to feel a little bit of increased pain while your wrist is getting the hang of doing stuff again, okay?
Okay.
Yeah. We still want to watch how we're lifting things, and maybe not the Stanley yet. Maybe not the Stanley yet unless you're sad.
Okay.
Let's try to avoid the Stanley for now. And
But we're getting there.
we are getting there. We're getting so close.
Okay.
Yeah, so close. Okay, so I'm going to put this back on you. Okay, you put your hand in it like you do at home.
Okay.
Awesome. And I'm going to show you how I tighten these. Okay, so I put them tight, but not so tight that it's cutting that circulation in your arm, okay?
Okay.
So I'm going to show you this little trick I do to double check the tightness, okay? See, it's firm and tight. I'm also going to stick my finger up and underneath each one of these. If you can't stick your finger on there, it's too tight, okay?
Okay.
So this is how I want you to check before bed. I'm going to tighten that up just a little bit more.
Okay.
Okay, awesome. How does that feel?
Feels good.
Feels good, okay. And you feel good about this session?
Yeah.
I feel like we're making some progress?
Yes, I do.
Okay, good. So yeah, I just want you to wear this while you're sleeping. I don't want, since you're not wearing it all the time, I don't want you to leave it in the heat. Don't leave it in front of a window or in your car. And don't leave it by the stove. I know you're not going to do that. But yeah, so you can clean it in the morning, you can clean it anytime, but it's probably better just clean it in the morning when you get up, and use some warm water and light soap, and probably pat dry it, let it dry, don't let it dry in the window, because you want this to be completely dry by the time you put it on that night.
Okay.
So that's the only reason it'd probably just be better to clean in the morning and leave be. You can set it by your bed or by your chair or wherever you rest, okay?
Okay.
Does that sound good? Okay, awesome. So I'll see you next week.
All right.
Yeah,
Thank
good.
you.
Thank you.